Hello, Martine Santerre here from Soul Being, and today I am with Nancy Dengan from SpectraCell Laboratories. Nancy, welcome.
Thank you. Thanks for having me.
Thanks for being here. So Nancy's background is as a registered dietitian nutritionist, and today we're going to talk just a little bit about functional medicine and the role that testing plays or doesn't play. So welcome.
Thank you.
Awesome. So let's talk about that then, because I think a lot of people don't know about testing and what different types of tests are and how that connects to functional medicine.
Sure. Yeah. Thanks. Functional medicine, it's sort of about getting to the root cause of conditions. Mm-hmm. So a lot of people are very quick to diagnose and treat a condition where our testing helps get a deeper dive into that. So we offer a variety of testing. We offer some cardiometabolic, we offer thyroid, hormone, we do some genetic markers, which are super important. But our signature test is our micronutrient test. And how we differ is that we actually look intracellularly at how well the body is actually absorbing and utilizing the nutrients that you get through diet and supplements. So as opposed to if you get your blood levels drawn at your local hospital, it's a snapshot in time of basically the last 24, 48 hours of what you've eaten and taken. Ours gives like a 4 to 6 month window of how well the body is actually absorbing and utilizing those nutrients.
Fascinating. So then, do many people take supplements not realizing that the body may not be absorbing all of those, and that's why this is good information?
Great question. Thank you. Yes. So we've all heard, the one a day or,
the multivitamin.
Exactly. Right? The supplement of the week. And a lot of those can be great, but unfortunately a lot of people waste a lot of money. So taking our test, you don't need to be fasting and you don't need to stop supplements. And it truly tells you if you're not absorbing and utilizing what you're taking, then you probably need to find something else to take.
There's no reason to buy something and take it every day thinking it's going to do something for you, because that's maybe the general information about the benefit of it. When if your body's not going to absorb those nutrients, it actually doesn't matter.
Exactly. Yeah. Perfect. Couldn't have said it better.
Great. So then can you give us an example of that micronutrient test? What types of things it's looking for? You talked about how it works intracellularly. Mm-hmm. So what does that mean?
So it measures about 33 vitamins and minerals. Some of your standards, vitamin C, glutathione, CoQ10, and we've all heard of these things in various forms and whatnot. But some of them are inflammation markers, or some of them can help with gastrointestinal health. And the providers that offer our testing have resources that identify some conditions and how these nutrients play a role in those conditions. Things like sleep apnea or gastrointestinal health, or even anxiety or pain. A lot of those can be based in nutrient deficiencies.
Oh, fascinating. And so is there a certain, for example, for anxiety as a condition or sleep apnea, is there a certain set of nutrients that you're testing for and then that are connected with a particular condition? And if somebody's deficient in one of those, then they know that they're...
Yeah, sort of. Although,
explain how that works. That might not have even made any sense. So just trying to wrap my head around this. I think it's something a lot of people
So we test for the full panel regardless. And that's just based on the technology that's used at the lab. I won't get too much into it, but they plate them out, and there's a certain number of wells, and so anyway, we do all the testing.
Very detailed scientific work happening.
Explain it
to the experts. Leave it to the experts, exactly.
It's a total proliferation assay, if you must know.
Wonderful. That sounds
stimulated
great.
with a mitogen.
Yes, please.
However, for our purposes here, essentially, so we do test for 33 vitamins and minerals. And then based off of that, you can identify some deficiencies that are commonly correlated with certain conditions.
That's very clear. Thank you.
Sure.
That helps. So then have you done any testing for yourself? Do you have any personal history with
I have.
this?
So I did my own testing when I started with this company, and it was fascinating, eye-opening. As a dietitian, I always thought I ate well. Turns out that, as I mentioned, we do have some genetic markers. So I have 2 SNPs of my MTHFR gene, which basically means that I cannot methylate my B vitamins.
Okay.
So I need to be supplementing with a methylated form of those.
Okay.
So
me too. My functional dietitian told me the same thing.
See?
I need that methylated version.
I think it's pretty common,
Yeah.
but I had never even heard of it until
Sure.
I started working for them. So that was super interesting. Another really interesting is another genetic marker we offer is apolipoprotein E. And you can have various forms or so there's E1 and E2 and E3 and E4, and then you have 2 of them. So you can be any combination of those.
Okay.
And so I happen to come out as E4, which again, way more than I need to get into today. But basically it means that I have a genetic predisposition to Alzheimer's.
Okay.
And my dad actually had Alzheimer's. So it was super interesting and a little bit of a wake-up call. But it is only one factor.
Okay.
And, but, you know, certain things like gluten can be eliminated. So basically you want to eliminate plaque formation in the brain.
Okay.
So diet, lifestyle, exercise can all play a huge role in helping prevent that plaque formation.
Okay, got it.
So I just know to be hypervigilant there.
Yeah. So that's really interesting then. So these types of tests are a way to get that information of what's going on in your body and what those genetic predispositions are so that you can then prevent disease by making lifestyle choices.
Absolutely.
Taking supplements.
Yeah.
Very cool. That's really interesting. Thank you for sharing that.
Sure.
So lastly, just talking about this, how can patients get access to this type of testing?
So we recommend going through a provider.
What types of providers?
So a provider can be a dietitian, a nurse practitioner, a traditional MD, a naturopathic doctor. Chiropractors sometimes do our testing, acupuncturists sometimes do our testing. So anyone that's really interested in sort of the integrative, holistic, functional look at medicine.
Great.
And if they don't currently have an account, it's super easy and it's no cost to start an account. So if you really want to get this testing and your doctor or provider does not currently offer it, they certainly can.
Wonderful. Well, thank you so much for answering our questions, Nancy. To get in touch with Nancy, whether you're a provider or a patient wanting for more information, you can contact us at soulbeing.com. Nancy, thanks. Have a great day.
Thanks so much.